So our next presenter is Dr. Om Prakash. Dr. Om is an associate professor in the section of gastroenterology. Dr. Om is our APU PGNE alumni. He's done his FCPS in medicine and gastroenterology from APU, and he is currently the service line chief of GI and surgery. Dr. Om is going to talk about gastrointestinal manifestations of COVID-19.
Thank you, Dr. Natasha and Dr. Tariq, for conducting this excellent course with the second in line. And as I heard that this is the first largest attended course in Pakistan. So as far as we are talking about this COVID pandemic, so this has given us a lot of opportunities as well, and given us a lot of rooms to improve and create new avenues of education, research, and management of the patients. So the topic of my talk is related to my specialty. So that is the gastrointestinal manifestation of the COVID. So as of today, like almost everyone is expert in the COVID because of the electronic things. So last time I did ask Dr. Tariq that why you have not included the GI in the course, because majority of the one fourth of the patients have GI symptoms. So that should be discussed in this course as well. So thank you, Dr. Tariq, for including this time into this course. So as usual, I have nothing to disclose for this presentation. So objective will obviously be to understand the different GI manifestations and to understand how liver involvement and its different manifestations. So before going on to these things, I will also give you the outline about the current status of the COVID. This is of as today's of early morning, the world global map of the COVID where we stand now. So almost more than 27, like 2,72,000 people have been infected, and more than around 9 lakh people have died. About Pakistani setup, this is of today early in the morning. That you know that as Aisha has already mentioned, that the incidence of the COVID positivity is significantly reducing, thankfully, and so we have not seen that much impact in terms as the Western people have seen. Somehow the South Asia is not seeing that much severe disease. So, as you know, that the COVID is a novel virus which belongs to the family of the beta coronavirus. So it has, so far we have seen three. This is the third catastrophe related to this type of a virus. Before that, we have heard about the SARS in early 2000, and then we heard about the MERS, Middle Eastern Respiratory Virus in late teens. So these are the two pandemics which happens before this, and this is the third pandemic that is being called as the worst event in the history of the humankind after the World War II. And we pray that we should not see such events in future for our generation. So this is the first SARS COVID which happens in 2003, and then the MERS happens in 2012, and we began this COVID-19 in late December 2019, where we didn't know much about this typical or atypical virus at that time. So this is how the virus has spread to the human. As far as so, these three viruses come from the bat, and currently the SARS-CoV-2, which has come from the pangolin. This is a paper published recently in Nature. So the COVID, I would say it's a syndrome which affects every organ of the body. Predominantly, obviously, it affects the respiratory system, but it does affect the almost all organs. The illness. So it's mostly it causes the acute respiratory distress syndrome. So as I told you that this is the worst catastrophe after the World War II. So when this begins pandemic, so no one was ready to tackle this type of pandemic, and then the world has rapidly prepared, and so many of the countries you have seen that they were not ready and they have failed in managing these patients, even the world best countries. So nonetheless, we must all continue to do our part to prepare our patients, clinics, hospitals for the drastic changes necessary to mitigate the spread of the SARS-CoV-2. Related to this, Aisha has already covered this, that how our hospital has responded to the SARS-CoV, and thanks to our administration and leadership, they have done a fantastic job and managing since December when the world, the WHO has announced that we are going to face the pandemic. They developed the committee in local university and they keep on going on daily basis. So they work day and night to handle this, and they have done wonderful job. And they have now the data is coming out, and our results are fantastic. So it's a single stranded RNA virus that replicates using well-encoded RNA independent polymerase. SARS-CoV bind and internalize to the receptors. These are commonly known as SE, angiotensin converting enzyme inhibitors, and these are the receptors which are responsible for the entry of this virus. So these are the receptors which are present in my specialty, like the small intestine and the colon and the liver. So from where this manifestations comes. So these are the systems which are affected in the COVID, the predominantly obviously the pneumonia and the ARDS, and you can see it affects all the systems. But I'm going to talk about the intestine and the liver. So, but in the GI, obviously there are 3, 4 organs which are affected: the stomach, the intestine, the pancreas. The recently the case report, the case series has come up that it can manifest as an acute pancreatitis as well. So liver is involved, and it also all kinds of drugs, infections, alters our microbiome because now it's a big field which is coming up and it's a new era which is arising. So the people have done research on it, that it also creates the dysbiosis in our body as well. So how does it affect the intestine? As I told you that the SE inhibitor, the SE receptors, these are the receptors which gets bind to the virus and it gets into and it initiates the inflammation and it causes the symptoms. And what are the symptoms? The symptoms frequency varies from east to west, north, south. So it varies from different studies to studies, but now the meta-analysis have come up and as recently published. So the predominantly symptoms are the nausea, vomiting, anosmia, like smells, bad taste in the mouth. These are the common symptoms that people do develop. Anorexia ranging from 30 to 40%. They can have a diarrhea because of small intestinal, and they can shed the weather. A lot of papers comes up that the virus does get shed in the stool. They have detected in this PCR have been detected in the stool, and they can have a hepatitis, which is the most common. And I will discuss in detail about the hepatitis because it is a multifactorial or multi-pronged injury to the liver. Virus as well as the drugs lead to the hepatitis. So this is the meta-analysis which has shown that like we used to say that 15 to 25% of the patients do have a GI symptoms, but this meta-analysis have shown that they have divided the studies which were published from the China and the studies which were published from the out of the China. So surprisingly, the studies which have been done from the China, the overall the prevalence is ranging from 7 to 16%, which includes a deranged liver function test, abdominal pain, nausea, and diarrhea. But when we compare with the Western and the China is reporting less GI symptoms, but the Western or the out of China studies are reporting the higher number of these derangements in the liver function test and the GI symptoms. But having said that, the overall based on this meta-analysis, the frequency is from 7 to 16 or 17%. So GI symptoms are, so they have concluded that the GI symptoms are associated with the COVID-19 in less than 10% of the patients. In studies, I told you that they have reported a higher number of. So then another meta-analysis they published that does GI involvement affects the overall outcome of the COVID patients? Yes. As Aisha has told us, there are certain risk factors which are associated, and everybody knows it. But this meta-analysis also shows that if someone has a GI symptoms, they can have a bad outcomes because the people are tend to have a GI symptom, they are diagnosed late, so they get early treatment very late, and they arrive in the hospital late because the people who have a respiratory system they tend to come earlier. That is why these people get late into the hospital. So the people, as Aisha has already told you or discussed with you, are informed us that there are certain risk factors which are the older age group, the diabetes, the people who have got the ischemic heart disease, the people who have got the morbidly obesity, and the people who have got the underlying liver disease or chronic obstructive pulmonary disease. And the mortality range from 8, if the age is more than 65, the mortality is 8, if the age is more than 80, the mortality is 15%. And similarly, each comorbidity has a contributing factor to the mortality. So how does it affect the liver? So as I told you that the frequency is approximately from 5 to 20%. So in some studies, the people have shown that more than 50% of the patients do have a deranged liver function test. So the people have done that. What is the underlying mechanism for creating the liver injury? So they have done the liver biopsy, and the histology has shown that it is consistent with the microvascular steatosis and mild globular and portal activity, which indicates that caused by the either SARS-CoV or drug-induced liver. So it means that the liver injury in COVID patient is difficult to identify that whether this is because of the SARS-CoV or the drugs which are used to treat the COVID. So there are certain mechanisms. So hypothetically, so this paper is published in Nature, and there are papers in the Nature and Lancet and Nature as well. So they are hypothetical. They are saying there are 4 to 5 mechanisms which contributes to the liver injury. So this is a typical cytokine storm syndrome like thing, in which these markers get elevated and the liver function gets reduced. So this is like similar. Any kind of a sepsis can lead to the deranged liver function test. So another mechanism, which is the direct cytotoxic effect of the virus because of the AC2 receptors which are present in the liver, and that gets inflamed and cause release of the liver enzymes. Another is obviously that these people develop hypoxia, and then hypoxic liver injury is there. And these are the different multitude of injuries and cartoonic picture. Another mechanism is a drug-induced liver injury. So as Aisha informed us about the different drugs which are used, but there are many drugs which have been used. But in the China, the traditional herbal medicines have been used as well. So these are different drugs which are in the mepolina, ritonavir, remdesivir, chloroquine, tocilizumab, and aminofir. These are the drugs which have potentially hepatotoxic effects. But having said that, because of their hepatotoxicity, you should not avoid giving these. It's just clinical judgment. These drugs can be given in these patients. So the third mechanism is the reactivation of the underlying liver disease. If the patients have underlying liver disease, if this virus is given, they are infested with this virus, and they have these drugs are given, then they can have a deranged liver function test, and their outcome is not good as compared to the people who have no liver disease. So again, so the CDC considered those with liver disease to be at increased risk. It is unclear whether patients following conditions are at increased risk for liver disease, such as cirrhosis, autoimmune hepatitis, or the people who are on immunosuppressive drugs. Now the data has come up that they have not, like as we were fearing that these people are not going to do, they are going to go worse with this COVID, but luckily we have not seen that much because we need further studies of those. So again, in summary of the liver injury, so again it's a multitude like direct cytotoxic effect, underlying liver disease, direct drug-induced, hypoxic liver injury, and there's obviously the immunological response, that is cytokine storm syndrome-related liver injury. So again, another cartoonic, very good picture which was published recently in an article, which is showing that how the liver gets affected and how the GI gets affected, and these are the like molecular level, what cytokines are involved, what effect is there. So what are the clinical implications for the management of liver injury during the COVID-19? So once you see the patients who have got the deranged liver function test, then obviously you have to order, because we are living in a country where we have more viral hepatitis. So we have the more common reason for having the liver disease is the viral hepatitis, and now we are seeing more fatty liver disease as well. So having said that, before labeling those patients have a COVID related, you have to, if these enzymes are significantly raised, not like mildly raised, but if they are significantly high in hundreds, then you have to rule out the concomitant diseases like concomitant infections, and you have to go for the imaging as well to rule out whether venous occlusive disease or some other diseases. And then based on those findings, you have to decide, right? So regular monitoring of the liver biochemistry should be performed in all COVID-19 patients when you see those patients. Serological testing, as I told you, that there needs to be confirmed for hepatitis B and C. If the enzymes are 1,000, then you have to rule out the acute viral hepatitis A and E. So to date, data on the safety of drugs, as we discussed, that the drugs which have been used in the COVID-19 have a potential hepatotoxic injury. So that we have to be very careful in prescribing those drugs, but it should not that you should stop giving those drugs. So the presence of abnormal biochemistry does not seem to represent a contaminant, as I told you that should not use. And like this is the pandemic that has given like a very rapid approval for the trial basis. So that should be given, that should be started, and they should be continued, and leaving aside the liver injury, but keeping an eye on those liver injury related things. So the outcome of the patients with liver injury is satisfactory. Alteration of the liver enzymes usually transient, and severe liver injury is rare. So no death has been documented to directly related to the hepatic decompensation of patients with pre-existing liver disease so far. So, these are the global approach, but I'm talking about my clinic. So when we are of time. So how do we are managing our things? So in this, I must say thank you to our management and our leadership that they are doing wonderful job in helping us in providing those PPs, and how do we are managing those GI and liver patients in our clinics. So obviously, the world has got three approaches to control this virus. One is the Chinese approach, that is the very strict isolation of the cities and individuals that flattened the curve. That was the initial, and then there's the European approaches. There are three different types of approaches. German approach, that you have selective isolation and social distancing, that is nowadays being practicing obviously in Pakistan, and then is the Sweden model, that is the herd immunity, that you just develop the herd immunity. So these are the global approach, but I'm talking about my clinic. So in the clinic, so when we had hit this pandemic, so we did the brainstorming, and then we come up with a new SOP. So this is how that our clinic looks like, and we have a special social distancing so that the people are taken care of very well, and our capacity has reduced. So at the time, so our working, we have increased our working timings so that we can accommodate maximum number of patients without compromising on social distancing. And where we can, and so simultaneously, this pandemic has taught us and given us an opportunity to initiate for taking the advantage of the electronics by, so we created the teleclinics, which was pending for many years in our university. So, but this pandemic has pushed us to develop the teleclinic, and that is running smoothly. And this is very good for those people who are afraid of or does not want to come to a clinic. But now, so this is how that we are doing, taking care of our GI patients and liver patients. And this is where we do our routine screening, so that the patient should be reassured that we are taking care of everything. They should not afraid of. They should come and visit our clinics, and they should not be afraid of and is associated with number of GI manifestation, which includes the diarrhea, nausea, abdominal pain, and vomiting. So virus receptor, as I told you, that is present in the GI tract, small intestine, and the colon, and it's associated with the virus shedding with the in the stool, and that is where you have to take care of the endoscopy rooms and these things. And COVID-19 is associated with the liver manifestation and the pancreatic injury. Now the people are coming with the pancreatitis as well. Patients with pre-existing liver disease, particularly NAFLD and liver cirrhosis, have a high risk of severe COVID-19, as I showed you a meta-analysis. And with this, I thank you. And the two MCQs have been shared with them. Yes, so these are the two MCQs. And thank you.
Thank you very much, Dr. Aisha. I can request you to please join Dr. Om, and we'll start off with a questions from the participants. There are a bunch of questions.